dispatched to a car accident when one vehicle involved and one female patient. PD and fire department are dispatched with us as well. As we arrive, PD has already ensured the safety funds, so traffic has stopped and we're able to get to our patient. So our scene is safe, we're wearing proper PPE. As we walk towards our patient, she's conscious and alert, and her skin looks pale. She's cold as I touch her and ask her what happened and if she's okay. She's cold and she's shivering from the impact. She's complaining of neck pain and chest pain, and she says that her face is burning. So before we move her out of the vehicle, we would place our a cervical collar on her neck, and we would ask fire department to help us, and we would place her in a longboard. So, what's that? No, that's okay. Okay. I'm gonna make a quick sweep of her body to make sure there's no bleeding or any other injuries, severe injuries of her. We asked the patient what happened, and she said that she was coming back to work from lunch and she lost control of the vehicle because of the wet road, and she struck the light pole. So I'm gonna start with my physical assessment, and just right now she has her her neck is her chief complaint. Sorry. I would start with her head, make sure there's no abnormalities or soft spots or bleeding. Then I would go to her forehead. Stop. To her forehead, down to her eyes. I would check her eyes. Okay. Her cheeks, her chin. Can you open your mouth? Can you stick out your tongue? And make sure that there's no bleeding coming out of both her ears. So her eyes are equal and responsive. Her face, there's no fractures or anything abnormal. Her neck, as I go, and she has a little cut in her chin. Her neck. So her neck right now is tender. She says that moving it makes it worse. She feels sore, and her severity is 6 out of 10. Okay, so I would go down to her shoulders and arms. Can you lift up your arm? Not this one. Lift it up. Okay. And go down to her neck. Her chest. She wouldn't be wearing clothes at this moment. Her chest is a little red. What it says? It's a little red, and I will check her lung sounds at this point. Breathe for me. Okay. So her lung sound good. There's no gurgling or snoring. No signs that there's any liquid on them. Now we're gonna assess her abdomen. So we're gonna don't do that. We're gonna check all 4 quadrants for tenderness or pain or abnormal structures. Does it tickle? so then down to her pelvis. It's stable and intact. Her genital area, there's no bleeding, there's nothing going down, nothing going wrong down there. And then we're going to check both her legs. We're going to start with her thigh. Can you move it up and down? Okay, good job. Okay, now, right here. Now, here. Can you wiggle your toes for me? To this side now. Okay. Up and down. Can you wiggle your fingers? And I'm going to check pulse on both sides. Okay, so that's good. She has a few cuts, abrasions, or insertions in her arms from the accident. Injury, back injury, and okay. So, for me to check her back, I'm gonna ask my partner to sustain her neck while I lift her up at, okay, we're gonna count, 1, 2, 3. And I'm gonna go down through her spine, all the way down. She's okay. So there's no injuries on her back. Okay, at this point we will transport and I will check for her vital signs. I'll stay over here. So I will check her, or would I check her heart rate? Let's check her heart rate in your arm. Wait, baby. Babe, stop pulling. Okay. We would check her glucose level, her blood pressure, her heart rate, her oxygen levels, and assist her with oxygen if she needs it, if it's necessary. So right now her pulse is 112, is strong and regular. Her blood pressure is 126/82. Her skin is pale, cold, and shivering. Her lung sounds are okay, they're regular as well. Her SpO2 is 97% at room temperature, well, the ambulance temperature. And she's on O2 because of the trauma and the accident. Her VGL is 92 and LOC is ×4. What are you doing? Yes. Okay, so we're transporting, our trauma center is 30 to 35 minutes away, I believe. We are close regular. So we're gonna wait for the oxygen to calm her down and assist her and talk to her and try to get her medical history, her allergies, her medications, and she informed us that she's not drug use, or she has no allergies, no medication. Her past medical history, she had her appendix removed in 2003, and that was it. So after a few minutes on transport, we checked her vitals again. Her pulse now is 94 and strong regular. Her blood pressure went down to 118/78. Her skin is pink, warm, and dry. Her lung status, no change. Her SpO2, no change. BGL, no change. And LSD, no change. And yeah.